What does a healthy, balanced lifestyle consist of? How should you eat? What exercise should you be doing? How many hours of sleep do we really need? Does too much water flush away all your vitamins? Should it be high carb, low fat, or high fat, low carb? The more research you do, the more confusing it gets, because there is so much information out there, and there are so many conflicting opinions. So how are we supposed to know? Stick around to explore the different approaches to health with us, physically, mentally, and emotionally, and let's try to figure out together what the heck being healthy really means. I am your host, Hazel Priscilla, and this is your weekly dose of Feed Me Honesty. Good day, goeiedag, dumela, namaste, bonjour, hola. You are listening to Feed Me Honesty, and we are so glad that you've tuned in. If you don't know dietitian Janke Wessels by now, where have you been the past 12 episodes? For our brand new listeners, Janke Wessels is one of our go-to dietitians who we check in with on a regular basis to get her professional opinion on different health and lifestyle-related topics. And since we last spoke to Janke, she had one of her articles published in the Health SA journal, and this is the first article that was published that she was the head author of. So congratulations on that, Janke. Today we have her on the line again, and the two of us are going to sit down to have a casual conversation about hormones. Yes, those little chemical messengers that play such an important role in our mood, growth development, reproduction, metabolism, and sexual function. And because this is such a broad topic, we've decided to make it a two-part episode so that we can give you as much information as possible. Our endocrine glands are supposed to produce the exact amount of each hormone that we need. But these days, hormonal imbalances are not uncommon. That's why we will attempt to get to the bottom of these imbalances. Because as always, we refuse to play the victim, and we are going to figure out together what we can do to find and restore the balance. As Arjun Das said, in Ayurveda, which is an ancient medicine system for those who didn't know, health is your natural state of being, and not the other way around. I think that's enough of an introduction. So Janke, hello again. I almost don't want to say welcome because it doesn't feel like you ever left.
Hello, it's really lovely to be back. And since we discuss hormones today, I can really feel my adrenaline levels. It's not in the normal range currently.
I just quickly have to mention that every aspect of today's topic does not exactly fall in Janke's area of expertise, but she has agreed to do some research for us on the questions that she can't answer from practical experience, so I am a particularly appreciative host today. I think let's start with the male and female hormones because I have an idea they might be the ones most people are familiar with. So estrogens are the female sex hormones and androgens are the male sex hormones. What some people may not know though is that males and females possess both of these types of hormones. Men just have a lot more androgens and women a lot more estrogens. I have to say, I was quite surprised to read that androgens actually have more than 200 actions in women. Janke, can you perhaps first explain to us what all the differences are between androgens and estrogens?
It is indeed an interesting fact that males and females have both of these types of hormones, and I will just briefly explain, or at least try to explain, what are the differences between these two respectively. Firstly, if we look at the androgens, such as testosterone, it's produced by the body in greater amounts in males than in females. And androgens, it's a critical steroid hormone that regulates sexual development and also differentiation, including the formation of the reproduction system and also the maintenance of its functions. And testosterone, it's a very essential hormone in muscle development, and that is also why men has a much higher, in general, they have a much higher muscle mass, and also they build muscle very easy, or much easier than women. And then if we move on to the estrogens, it is produced by the body in greater amounts in females than in males. And this hormone is really necessary for the normal sexual development in females, for the regulation of the menstrual cycle during childbearing years. And at the onset of puberty, it is actually very involved in sexual characteristics such as wider hips and breasts, and actually with one aim in mind, to prepare a female for childbirth and also to care for a child via lactation or breastfeeding with the development of the breasts. And as women, when women approach with age and when they approach menopause, it's very normal for estrogen levels to drop.
Now, can you explain to us what happens when there is an imbalance of these specific hormones, and what are the symptoms we can look out for to identify that there might be a problem?
Well, there is for surely a big spectrum of imbalances of specific hormones. We basically find women, in the case of these types of hormones, we will find women with higher androgen levels and men with higher estrogen levels. And this will then cause imbalance. We as dietitians are quite familiar with a condition called PCOS. It's polycystic ovary syndrome, and this condition it's usually under the spectrum of the metabolic syndrome, and there we do treat it and we do try nutritional interventions. But when we look at general symptoms that might be an indication of imbalance of the specific hormones, it will be women with acne, unexplained weight gain, excessive hair growth, also dysfunctions with the menstrual cycle and infertility. And in men, if estrogen is in excessive levels, it might stimulate breast tissue to grow and also erectile dysfunctions. And then, because there's then usually a lower level of testosterone, it will mean that they will have also a decrease in muscle mass, and usually it comes with an increase in fat percentage.
Now let's focus on what we can do to restore the balance. Perhaps we can look at it from a diet perspective and try to take a more natural approach, because we all know that hormone medicine can really have a lot of negative side effects.
Yes, I'm not an expert when it comes to hormone therapy, but out of research we can conclude that it might not always be the safest intervention, but still it is very widely and quickly prescribed. And also for me, it's important to keep the experience of the patient in mind. We must remember that patients are humans, and especially in the medical world, it's sometimes patients are really treated not in a very sensitive way, and they are almost treated as robots, especially when it comes to hormonal therapy. And I know out of my patients that I know out of experience that it's not always a pleasant and easy route for many of them when hormonal therapy must be becomes an option. And firstly, I think it's important to confirm the imbalance with a proper diagnosis, and not just to make diagnosis based on the presence of symptoms. And luckily for me as a dietitian, that will not be my job. So as a dietitian, we get a confirmed diagnosis of an imbalance, and then we start each case individually. So it's difficult for me to give you, the natural approach. But the natural approach will be, on a nutrition level, will be to assess this patient, to do a proper diet history, to then make a nutritional diagnosis. So we get the medical diagnosis, but we make our own nutritional diagnosis, and then we start with some nutritional interventions, and we usually focus on lifestyle and dietary factors. So it is really an individual approach.
I think it's time to move on to the next set of hormones, which I know you have first-hand experience with, the pregnancy hormones progesterone and prolactin. Janke, please give us a better understanding of how exactly these hormones relate to pregnancy and what their specific functions are.
Well, when you just generally think about the pregnancy, it's really an amazing thing that happens in quite a short period of time. 9 months, it's not such a long period of time if you think of it. And a whole new human, it's born out of a human. It's really amazing. And there are many things that happens, and many hormones that's involved. But I think if we just focus on the main hormones, whenever we discuss pregnancy, it's just easier to refer to 3 trimesters. We usually divide pregnancy in 3 trimesters, and each trimester are made up of 3 months, and that will then add up to the 9 months period. But when we start with the first trimester, a hormone that's quite one of the key hormones during this period is HCG. And this hormone is active as soon as 10 days after conception. And this is also then the hormone that will be tested in the blood or the urine of an expected pregnant lady. And the main function of this hormone is actually just to keep the corpus luteum functioning, because the corpus luteum must produce estrogen and progesterone. And estrogen, it's still a chief hormone during pregnancy. A woman will actually produce more estrogen during one pregnancy than throughout her entire life when not pregnant. And that might be the reason why a pregnant lady is very unpredictable, because of this extreme high estrogen levels. And then along with estrogen, progesterone is also a key hormone during pregnancy. And like I say, there are a few other hormones also involved during pregnancy. So during the last period of the first trimester, estrogen and progesterone are produced by the corpus luteum. And then when we move on to the second trimester, the levels of estrogen and progesterone, it still increase throughout. But then the placenta starts to take over the role of the corpus luteum, and it starts to produce estrogen and progesterone. And by the time of the third trimester, only the placenta produces estrogen and progesterone. So it takes this function over. But throughout pregnancy, testosterone is very important to actually relax smooth muscle. And we want the smooth muscle to be relaxed, actually to prevent the uterus or the labor process to start, to prevent contractions. And then around about 40 weeks, this is usually towards the end of the pregnancy and towards the end of the third and the last trimester, then we will see that estrogen and progesterone will start to drop. And basically, in order for the uterus to contract and basically to induce labor or for labor to take place. And the moment when these two hormones drops, it's actually a sign of labor. But we find two other key hormones also at the end of the pregnancy, and the two that I'm just quickly going to talk about, it's oxytocin and prolactin, and they are very much involved in the labor process. They assist with labor and also with breastfeeding and lactation. This is the two key hormones. We need oxytocin and prolactin, and they assist with the stimulation of breast milk, also the production, and they also play quite a key, especially oxytocin plays a very vital role in social bonding between the mother and the baby, which it's really amazing. So these two hormones, oxytocin and prolactin, it's from labor and also the period after labor. They are quite essential.
How do you assist women or couples who are struggling to fall pregnant?
Well, we as dietitians, we are very glad about it, but we do see an increase generally in referrals from gynecologists, mostly women pre-pregnancy, in preparation for pregnancy, and in lots of cases we see referrals where we must actually assist women to reach their ideal body weight before pregnancy. So it's actually pre-pregnancy, which makes sense in many reasons. It's really it's actually advised. In the case where a female patient is struggling to fall pregnant, once again it is an individual approach for us as a dietitian, or for me as a dietitian, to do a full nutritional assessment, diet history, make a nutritional diagnosis, start with nutritional interventions and treatments, focusing on things, once again, like diet and lifestyle. Even though some observational studies suggest that a diet that's characterized by a lower intake of trans fat and a higher intake of plant fats, things like animal protein must also be lowered, with a higher intake of vegetable protein and also a higher intake of fiber, focusing more on low GI carbohydrates, a higher intake of dairy products. It's all associated, like I say, out of observational studies with higher fertility rates. And if you really think of this that I just named, it basically comes down to the prudent, balanced diet. lots of what we discussed, I think, in the first episode of Back to Basics. But firstly, I feel that yes, infertility, it's quite common. I mean, in South Africa, infertility occurs in 15 to 20% of couples or of the population. So it means 1 in every 6 couples will struggle with infertility, and it might come from the men or the women. We must evaluate. In each case, we must evaluate the possible father and the mother. And when a couple or a woman struggle with infertility, we only aim to optimize their nutritional status. So, and like I say, there are quite a few interventions nutrition-wise that we can look at or try to improve. So we look at anthropometrical measurements, like I also said in the beginning, of the ideal body weight, waist circumference, also total energy intake, looking at specific nutrient intake, gut health, also very essential. We evaluate if supplements must be considered. And so we really, it's individual, and I can't, tell you this is what we do or this is what we do. So we take each patient as an individual and work from there. But what's very important, I think, for the general population to keep in mind, that this is a very sensitive matter, and it's very important that we don't give a patient false hope. So whenever we give intervention, it's truly to optimize nutritional status. We as a dietitian, it's not really that much in our hands to increase fertility, but we can optimize nutritional status that might increase fertility. I personally, if I can just maybe add a bit, I will be very briefly, but I do feel that actually any woman that plans to fall pregnant, it's really beneficial to consult a dietitian for many reasons. But nutrition during pregnancy, it's really important, and we see as the research comes forward that there's so much focus on nutritional status of the mother during pregnancy, and not just the mother, also the father. I mean, we sometimes we just neglect the father, and we forget that half of the DNA of the unborn baby, it comes from the father. So optimal nutritional status, actually pre-conception, it's also very important, together with when we focus on the mother, optimal nutritional status throughout pregnancy. And there's so many things to consider. And for looking at the baby, there's a lot of focus on the first 1,000 days of your life, and that's actually the period from conception till the age of 2 years. And so for me, I actually feel very strongly about it, that all women must consult a dietitian actually when they plan a pregnancy and also throughout the pregnancy.
Moving on to hormones of thyroid. I think this one relates to your profession in a great way, Janke, because these hormones regulate weight and control your metabolism, among other things. How often do you come across clients who are actually eating relatively healthy and are relatively active, but who are still overweight due to a hormonal problem? I was just wondering how common this is.
Well, firstly, in my practice, I don't see the inability to lose weight due to a hormonal problem as the primary cause. So often, even if there is a hormonal imbalance, lifestyle and diet adjustments are very good interventions with positive outcomes in terms of weight loss and also weight maintenance. But hormonal imbalances, it's not something that we can just ignore, but it might take years for an accurate diagnosis to be made, because we have about 50 hormones in our body, and a proper and correct diagnosis is needed. We need to get a course of the presentation of certain symptoms. And when we refer to the thyroid, it falls under the pituitary gland. And symptoms of an underactive pituitary gland will then depend on which types of hormones are produced or which types of hormones are not produced in sufficient levels. And in the case of the thyroid, with the thyroid stimulating hormone, or TSH, when that specific hormone is deficient, it might lead to an underactive thyroid. So this is just one of the hormones that's actually produced by this gland of the pituitary gland. And it might have a negative effect on metabolism, and symptoms might include cold intolerances or an intolerance to cold, weight gain, chronic constipation. But yes, I don't see it so often. It might be that the cases are not always referred to us, or it might be that it's not always diagnosed because it's not an easy diagnosis.
What other symptoms are there that may indicate an imbalance of these specific hormones other than not losing weight, no matter how hard you try? I know there's also the other extreme where you can't seem to put on weight no matter how hard you try. We are still talking about hormones of thyroid, if I lost some of you there.
I'm almost scared to just name the symptoms because it might lead to self-diagnosis. And, because of some of these symptoms, it's really general and broad, and there are lots of symptoms, and I believe that we can't just make a diagnosis based on symptoms, especially with hormonal imbalances. If we suspect a hormonal imbalance, it's really advised to get a proper diagnosis. But some nutritional related symptoms might include chronic constipation, which it's related to metabolism in a great way, and abnormal body composition, where we will find an increase in fat accumulation around the waist, also weight gain or involuntary weight loss, a decrease in muscle mass, adverse lipid or fat profile, also a loss in menstruation or infrequent menstruation in women, men and women that don't have interest in sex. So I'm sure that you can see that there are really a lot of symptoms, and that is we need a proper medical diagnosis.
We are going to leave it at that for part 1 of an introduction to hormones, but be sure to tune in again next week when we will pick up right where we left off with part 2 of an introduction to hormones. Before we go, I would like to thank our engineer behind the glass, Alex Meiberg, for dedicating his time, and I would also like to thank our production manager, Pieter Matthijser, for all the work that he does behind the scenes. Have a balanced week, and remember to be kind to yourself so that you can be kind to others too. Feed Me Honesty is a South African lifestyle podcast hosted by Hazel Priscilla and produced with the generous assistance of Blended Podcasts, brought to you by Blended Audio.